Hello everyone, welcome back to Careers Explained. My name is Alexander Lluch, and today we're going to be interviewing Dr. Aaron Biller, a naturopathic medical doctor licensed at the Naturopathic Physician in San Diego and in Arizona. Dr. Biller holds a Bachelor of Arts in Communication in Medical Studies from St. Mary's College of California and Doctorate in Naturopathic Medicine from the Bastyr of San Diego. Dr. Biller has 3 years of experience in the field as she is the first naturopathic doctor that has completed an Academy of Integrative Health and Medicine fellowship. Aaron, how are you doing today?
I'm good, Alex. Thanks for having me.
Thank you so much for taking the time out of your busy schedule to be interviewed by me.
Yeah, I really would love to spread more knowledge about naturopathic medicine and careers in naturopathic medicine.
Definitely, and I think this interview will really get the word out there, so I'm excited.
Yeah, I look forward to it. Hit me with your questions.
But let's start off when you were a teenager. How was your high school experience? Did you know what you wanted to do when you were in that stage of your education?
You know, I did, but I've had a career change. So I can tell you I went to a college prep in Arizona. I took college level courses and AP courses, and I entered into college at St. Mary's College already knowing what I wanted to do. When I was in high school, I was really very active. I did various clubs and activities. I was even the high school mascot, actually.
Oh, nice.
Yeah.
So was there any specific time in high school when you decided to realize that, the future is coming? Because I know for me, I'm a junior in high school already, and reality is kind of hitting hard in this year. So was there any specific time for you that made you realize that you needed to start, focusing on studies and stuff?
Yeah, I went to a school that had a very rigorous counseling program. So I think they tried to start it off freshman year, but it really wasn't until that junior year that you're mentioning where I really decided to buckle down and to get things in order and started working with a career counselor and a college coach in order to get everything into alignment for myself.
Definitely. Do you have any advice for high school students that are going through high school right now about, just anything?
Yes, I think there's a lot of pressure to always know exactly what you want to be doing, and people will be the first to ask you, what career are you going to pursue? I think it's important to break that down a little bit and instead connect one-on-one with individuals and get to know people and get to know what their strengths are and see ways and careers and ideas that might be helpful for them. I would say when I was in high school, I knew what I wanted to do. But I wish, looking back, that I had been a little more open to talking to other people in college and other individuals in different career paths. Because as I mentioned, I had a career change in my senior year of college, actually, as I will share with you later.
Okay, awesome. And, just going with the basis of our demographic being usually high schoolers, how did you decide to pick what major you wanted to pursue in college?
I was really fascinated by global communications and global relations, and I was really wanting to work in public relations. I also liked advertising and marketing and had some job experience from shadowing family friends and from talking to family friends and things like that. And that's how, before going to college, I knew that that was what I wanted to pursue. And I also looked at colleges in locations that I thought would be helpful towards being able to have a job in public relations, marketing, and advertising. So at that point, I really was looking at schools on the West Coast, in a couple schools in the East Coast, and primarily in major cities instead of really small areas. Or what came to work for me best was finding a college that was small and intimate that was very close to a major city.
Right. Nice. Yeah. So you explained that you went through a career change, and obviously now you're a naturopathic doctor. So what was your first career?
So my first career, really, I entered into college with all of those college courses in AP. I really entered in as a sophomore already. So I was able to bypass those general classes that you normally have to take in college.
Right.
And in particular, I studied management and communication as well as I have a minor in French. And what I really was looking at business management, organizational theory in regards to public relations and advertising job opportunities.
Right.
So that's what I did, and that's what I created in my own program as I went to a liberal arts school, and a lot of it was you still had to take some general requirements, yes, but a lot of it was self-motivated and working with the department and working with teachers one-on-one to get you the best education you needed.
Right. Nice. So now you went into naturopathic as a career. So
I graduated from St. Mary's College in Northern California. And it wasn't until sort of my last year in school I had a really great job. I worked in professional athletics for an event management and security company. And I realized I didn't really want to be working in a really large organization because you kind of get lost when you're working in a really large organization. And in professional athletics, it's fun when the team is winning. And when you're not working for a winning team, it's not very fun.
Right.
So even though my job had really great perks, for instance, lots of free concerts, some backstage opportunities, different things like that, I really realized that wasn't what I wanted to do. And it took a major incident in my life, actually. I was in an automobile accident.
Okay.
And I had a lot of wake-up calls from having to lean into other people and ask for help and needed to be taken care of and driven around and various things like that.
Right.
That I really realized that I wanted to go back to what my 3-year-old self wanted to do. So when I was 3, I knew I wanted to be some type of medical doctor. Okay. And then as a result of all of this happening in the 2006, 2007 time, I really decided that I was going to finish my college education with 1 degree and that I was going to go back to school in order to become a medical doctor.
Nice.
Yeah.
So can you give a quick overview of what actually a naturopathic doctor is?
Yes, a naturopathic doctor is a licensed medical provider in the state of California. I serve as a primary care physician, or primary care medical doctor, as we like to say. I am involved in treating the root cause of what's going on. I use what's called a therapeutic order to use the least invasive medical modalities before using higher interventions. So when someone comes to me, I like to discuss with them their diet, their lifestyle, their behavior, and I like to modify those before I immediately go and give them supplements or prescription medications. So that's what I do as a naturopathic doctor. I like to find why something is occurring, what it is that might be causing or is an obstacle to their cure, and how we can work together in order to help them be their own healer. I don't heal them, they heal themselves.
Nice. So essentially you're finding the root cause and you're trying to, fix that first before you go to supplements, like you said.
Yes. Before you supplements or medications or higher interventions really is what is really what's happening in a naturopathic medical appointment. Definitely.
Because I've heard a lot of, controversy where, medicine isn't always the correct answer just to go straight and when someone has an issue. So I think that's actually amazing how you want to find the root cause first before you go straight to medicine.
Yeah, exactly. And sometimes medicine is really needed and warranted for a particular case. If you're in, again, something similar to a major automobile accident, it's wonderful to have emergency medical services there, and it's great to go to the ER in order to triage the situation. But if you're dealing with something like chronic pain from a car accident or some side effects due to other treatments, a naturopathic doctor is a great person to go to sort of work through that chronic pain and or those other side effects you might be experiencing.
Nice. Mm-hmm. So what do you think is the main difference between a naturopathic doctor and an MD doctor?
Right, so naturopathic medical doctors are still trained in 4 years of medical school. Unfortunately, right now we don't have full residencies, of which we need support in order to get more residencies so that people can get jobs and get more training after school. That should be funded absolutely after a person is to graduate school. The main difference, I would say, between a naturopathic doctor and a medical doctor is that as a naturopathic doctor, I really have a very large toolbox. So not only did I study 2 years of basic science and then do 2 clinical years, I also learned other modalities. I learned physical medicine, I learned botanical medicine, I learned mindfulness. In my program, I happened to learn something called biofeedback, which is really wonderful for mental health. I also learned homeopathy, and I also learned various other physical techniques in order to best serve my patients. So while I am still trained to the same standards as a medical doctor for primary care, I also am able to use a large toolbox in order to access different types of treatments and use different modalities.
Okay. And I know you said, before you want to find anything like the root cause, like you said, like a diet. And let's say that doesn't work. So is it at that point where you prescribe medicine, or do they have to go to someone else?
No, so it just all depends on what we're doing. So I can give an example of something similar to someone dealing with high blood pressure. Let's say mildly elevated blood pressure. So first I might start with some diet behavior modification. So removing things from their diet, adding other things to their diet, and then changing how they deal with stress, and then changing their sleep, having them increase their exercise. Let's say that doesn't really help their blood pressure much. It usually does. Then I go to other treatment modalities using something along the lines of dietary supplementation or some herbs, as well as vitamins and minerals. And then let's say that doesn't work, or if the blood pressure happens to be much too elevated and absolutely warrants medication, then at that time I do prescribe prescription medications for something like that.
Okay. That's awesome. But now let's talk about like a typical work day. How is that for you?
So for me, a typical work day kind of depends on what day of the week it is and what it is that I'm doing. So I do work as a licensed naturopathic doctor in California. I also do have a telemedicine practice based out of Arizona, where I'm also licensed. So for instance, today I had a telemedicine patient in Arizona who previously came to see me in California, who I now am working with over the telephone in regards to their health and their health challenges. So I did a lot of behavior modification, dietary counseling, some supplement management for her, and then a lot of coordination of care between her and her other allied healthcare professionals. So she needed to have kidney support as well. So I put her in touch with a nephrologist, and she also needed cardiovascular support. So I put her in touch with a cardiovascular specialist in Arizona. And she also had something else going on with her blood. So I put her in touch with a hematologist also in Arizona so that she could have the best care possible, and that I can manage what part of her care is important for me, as well as make recommendations for her to see other healthcare providers, because there are certain things that I absolutely am qualified to manage, but sometimes a patient does, as mentioned, need higher interventions and needs to go see a specialist.
Okay, nice. So what do you find most rewarding about your occupation? And on the flip side, what do you find most challenging?
I think I can start with the most challenging part in many ways. So I'm very happy that I knew I wanted to be a doctor and that I pursued a career in naturopathic medicine, because my toolbox is so vast and wide. And I don't look at things from a reductionist manner. I look at it from a very holism manner so that I can look at all of the little details. So I really appreciate being a doctor. I am struggling a little bit with some of the bureaucratic behavior that we oftentimes hear about in medicine and in healthcare. And I can just acknowledge that there isn't enough time, even in my extended appointments with my patients, to really oftentimes get down to the root cause of what's going on, or to be able to properly spend the right amount of time on the right part of the patient that you need to be treating. Okay. Meaning sometimes a patient comes in and they have a certain chief complaint, and it comes actually sort of at the last minute that something else is going on and you've sort of run out of time. That's actually what was really important to the patient's care. That was the obstacle to cure. But instead you spent all of that time just going over sort of that patient's chief complaint, past medical history of presenting illness, and review of systems. So that's what I would say overall. I also do think that some of the other challenges are communication within other medical systems. So paperwork, charting, getting patients adequate records and things like that can be very difficult.
Right.
Overall. And then most rewarding, I would have to say for me, is I really think it's a really great experience to see when someone takes responsibility for their health. And the smallest interventions can oftentimes make a world of difference. I had a patient that had a lot of nausea and fatigue and difficulty sleeping and various other things, and she'd been tested by numerous doctors, and she came to us kind of last minute, sort of last ditch effort as well, randomly booked an appointment. And, after everything we did with her, we did a couple other tests. And long story short, what she was really lacking in her life was water. So she thought she was drinking a certain amount of water. And I know this is an obscure example, but she actually was getting about half to a third of the amount of water she was consuming. And luckily, we kind of found that on some blood work. We thought maybe she was a little dehydrated. Right. And she started drinking water, and with more water became more exercise, and with more exercise became a healthier diet. And then, months later, she's just doing a lot better. And it was just really some simple interventions along things we have to do every day, which is drinking water, eating healthy food, and getting out and getting in the environment.
That's amazing how you found that.
Yeah, we have a lot of interesting, quirky stories. If you ever have time, I'm sure I can tell you some more.
Yeah, definitely. Well, now let's talk about salary. So how much can a naturopathic doctor make within the first, let's say, couple years of working in that occupation, and let's say after 10 years?
Yeah, let's say after 10 years. So I know you had some previous other questions that I think are helpful in order to answer this question in regards to salary and growth potential. I think in general, someone who becomes a naturopathic medical doctor really is going to need to be a self-starter, is going to want to take the initiative, is going to want to be resilient, creative, a good communicator. They're really going to need to be open-minded, and definitely collaboration is key. I can't work as a naturopathic doctor without the work that I do with individuals, as you mentioned earlier. So I'm the first naturopathic doctor to do a fellowship in Integrative Health and Medicine.
Right.
I'm currently in a cohort here. We meet in San Diego a few times a year. And in my fellowship is a bunch of other health providers, mainly medical doctors, doctors of osteopathy, a few psychologists, some dietitians, and a few other individuals like acupuncturists and other allied healthcare professionals. And it's really important to know that when you're treating the cause of what's going on, you can't do it alone. You really need collaboration between different healthcare providers. So I think those are some things that need to be acknowledged when you go into a profession like this. So a reasonable salary range for someone who gets out of school is important. I have really helped to coach individuals for negotiation, having had that management background previously and things like that.
Right.
So about individuals in the top 10% of their class get residencies. Residencies are sort of that amount is similar to other residency programs. Not really enough to live on, to tell you the truth. So really encourage individuals when they take jobs at other centers or when they're working in collaboration with other medical doctors, really, about $75,000 with benefits and a signing bonus. You need that signing bonus. Licensure is expensive. You also need medical malpractice and other things in order to go into the healthcare field. So I would say that's really what you're looking at, with basic reevaluation at that year mark is what I would say.
Okay.
I would also remind you that a lot of individuals leave naturopathic medical school and then go and start their own careers. And we know that in order to sort of even net what it is that you're putting out there when you're an entrepreneur, is a 3 to 5 year mark in order to have sort of any, basically to break even, let alone have any return. So There are a lot of individuals who are naturopathic doctors who, in order for them to work in alignment, is for them to actually be their own self-starter, to be an entrepreneur.
Right.
And that's something that salary range really depends on, again, how much that person is really willing to be a self-starter.
Right.
Because growth opportunities for naturopathic doctor are really limitless. There are a million different opportunities if people are willing to look into them. You can absolutely practice primary care or you can do other things. I've consulted for food businesses. I have consulted for juice companies. I have worked with individuals who are writing books. I've done various other things as well as practicing as a general practitioner of naturopathic medicine.
Right. Well, that's amazing. Now, as we get to wrap up this interview, is there any last tips or advice you would want to give to someone who's actually considering pursuing naturopathic as a career?
Yeah, I think it's the same advice that I would give anyone who's in school, which is if you think you want to do something, spend time with other people who are doing that. So contact something along the lines of the California Naturopathic Doctors Association. There's another one in Arizona, there's one in New York, there's one in Oregon, there's one in Washington. You can contact the American Association of Naturopathic Physicians and find a naturopathic doctor to talk to shadow. Go visit the naturopathic medical schools. There's one here in San Diego. There's also other ones primarily here on the West Coast. We also have Arizona and other ones. And there are organizations that I can help send people to and help facilitate that will help you to get the right information regarding naturopathic medicine. I think the more inquisitive you are and the more you ask questions and the more you experiment and see what it's like in the day of a life of a naturopathic doctor or see what it's like to go to school, the better off you really are. For me, how I sort of solidified that I really wanted to go into medicine after I graduated, I was in school in India. I stayed in India. I volunteered with an organization. I worked in women's reproductive health. And I really realized that was a good fit for me. It was a good fit for me also to study Ayurveda and to experience what using different health modalities and tools would be like when I practiced naturopathic medicine. And I also think if all else fails, another great advice and tip if you're sort of wanting to pursue something in medicine is to maybe go to a doctor yourself, book an appointment with a naturopathic physician, book an appointment with someone who is an allied healthcare provider and see how that feels for you.
Okay. Yeah, so essentially just get yourself out there and, talk to another one in the profession. So
yeah, and also I did all my post-bac pre-med. I went to various colleges in and around San Diego. I did things online. I did things in Arizona. I studied for and took my MCAT. I went and interviewed at other medical schools. And for me, those weren't a good fit, to tell you the truth. And that's how, when I did finally interview at Bastyr University, after interviewing at other naturopathic medical schools too as well, I really had a feeling that this was a good fit for me.
Right. Well, that's great that you found that because, finding something that you're passionate about is, I can imagine that's one of the best feelings.
Yeah, it's great. There's still a lot of chatter in your mind sometimes.
Yeah.
And parents can influence you one way or another, and society can influence you one way or another. But I think when you're really quiet with yourself and you're willing to ask yourself, what do you need, what do you want, and what do you desire, you can really get the answers for yourself and allow yourself to be in a career that not only you're passionate about, but is also really fun, and you won't have to deal with worrying about burnout from the things that are inevitable. Paperwork is inevitable. Bureaucracy is inevitable. But what's incredible is that I really do love what I'm doing, and I'm very satisfied by that.
Right. Well, Erin, thank you so much for taking the time to be interviewed by me today. All the information that you said, I'm willing to bet that it's so great and very informing to someone who's actually, interested in a naturopathic doctor. And if they didn't hear about it, now they know. So I think this was great to get the word out, and it was great information. So thank you.
Yeah, thanks for having me, Alex. It was awesome talking to you.
Thank you. And
cheers,
please remember. Sorry?
I said cheers. Bye-bye.
Oh, thank you. Well, please remember, if you like this video, be sure to click the thumbs up on the bottom of the video. And also click the bell notification so you get notified every time I post a new video. And also, if you have friends that don't really know what they want to do in the future, please make sure to send them a link to my channel so they can get a taste of what different careers that are in the world. Anyways, my name is Alexander Lluch, and this is Careers Explained. Thank you.